amigos, feliz viernes. Hoy es viernes, yo soy Rory, estoy contento de estar aquí contigo. Hoy estamos conversando sobre los signos y los síntomas de la diabetes. So today we're talking about signs and symptoms of diabetes in Spanish. For the last several weeks, we've just been doing quick tips because we've been full on with our Mastering Medical Spanish course. But today we've got a full lesson. So let's get started with some vocabulario relevante. All right, these are in alphabetical order, not necessarily in any sort of order of importance for you and your conversations with diabetes. Okay, all right, cambios en la visión, so changes in vision. Cardiopatía coronaria, so coronary heart disease. Comida saludable, healthy food. Consultar con su médico, see or consult with your doctor. Controlar, control. El azúcar, sugar. El azúcar most times is 100% clear, just el azúcar referring to blood sugar. But if you had to specify, el azúcar sanguíneo, azúcar sanguíneo. El ejercicio, exercise. Enfermedad cerebrovascular, so cerebral vascular disease. Entumecimiento, numbness. Evitar, avoid. Fatiga, fatigue. Heridas se sanan lentamente. So injuries heal slowly. So this es el verbo aquí. So injuries heal slowly. Okay. Hormigueo. Hormigueo, numbness. Excuse me, tingling. Hormigueo's tingling. And infecciones frecuentes. Frequent infections. La diabetes, diabetes. Las bebidas azucaradas, so like sugary drinks. Las manos, hands. Llevar buen control. This is a good expression in español. Llevar buen control de or sobre la diabetes, el peso, la hipertensión, whatever it might be, is to essentially have whatever illness or condition under control. So llevar buen control de whatever it might be. Los pies, feet. Neuropatía, neuropathy. Orinar con frecuencia, frequent urination. Perder peso sin explicación, so lose weight without explanation or without trying. Tener hambre, to be hungry. Y tener sed, to be thirsty. So we're going to take a few of these categories or a few of these symptoms, signs and symptoms, and add some questions around them. Okay, so let's look at some preguntas that you might want to ask your patients about these things. Empezamos con orinar con frecuencia, so frequent urination, we'll start there. ¿Tiene que orinar con frecuencia? Do you have to urinate often? ¿Cada cuánto tiene que orinar? Every how often, or how often do you have to urinate? O usar el baño, use the bathroom. ¿Se despierta en la noche para orinar? Do you get up at night to urinate? ¿Cuántas veces? How many times? Notice it's not cuántos tiempos. It's cuántas veces. Veces is our word for occurrences. Okay? ¿Siente urgencia o dolor cuando orina? So do you feel urgency or pain when you urinate? Okay, so orinar con frecuencia. If you've got more questions about orinar con frecuencia, make sure you post them in the comments section and we'll help you with them, okay? Pérdida de peso, weight loss. ¿Ha perdido peso recientemente? Have you lost any weight recently? ¿Ha bajado de peso recientemente? Same question, just a different expression. So, perder peso is lose weight. Bajar de peso is to lower weight, but also to lose weight. It's just two expressions to say lose weight. Sin intentar. So sin intentar would be without trying, yeah? Or sin tratar is another verb to try. So sin intentar, sin tratar. So ¿ha perdido peso recientemente sin intentar? Or ¿ha bajado de peso recientemente sin intentar? Both of those, sin tratar could go with both of those as well. ¿Ha notado cambios en su apetito recientemente? Have you noticed changes in your appetite recently? Okay, here we got two different symptoms. Falta de energia, so lack of energy, and sed excesiva, so excessive thirst. ¿Se siente cansado o fatigado durante el día? Do you feel tired or fatigued during the day? Okay, don't ask a parent of like 3 teens that are all doing different sports and none of them drive and all that kind of thing. Okay, all right. ¿Siente cansancio o fatiga durante el día? So do you feel, it's the same question, it's just that here se siente cansado, slightly different construction, do you feel tired? So using the adjectives, cansado, fatigado, or cansada, fatigada, if it's a woman. But here it's siente cansancio. Now you're feeling the noun. It's two questions to say the same thing. Find one that you like better and stick with it. Siente cansancio o fatiga durante el día. Do you feel tiredness or fatigue during the day? ¿Puede cumplir con sus responsabilidades diarias? Can you fulfill your daily responsibilities? Okay. Sed excesiva. Siente que tiene mucha sed. Do you feel like you have a lot of thirst, or do you feel like you're really thirsty? La boca siente que está seca. Does your mouth feel like it's dry? Okay. Bien. Okay. Entumecimiento y hormigueo. Entumecimiento, again, is numbness. Hormigueo is tingling. Hey, if you're learning something in this lesson right now, make sure you subscribe to our YouTube channel and like this video. That's how we're able to keep doing this on a regular basis, okay? Okay, all right, let's see. ¿Cómo se sienten las manos y los pies? How do your hands and feet feel? ¿Siente hormigueo en los pies o en las piernas? So do you feel any tingling in your feet or in your legs? ¿Siente entumecimiento? So do you feel numbness en los pies o las piernas? Y, all right, es todo para este. Continuamos con infecciones frecuentes. So frequent infections. What's coming up with our frequent infection questions? ¿Tiene infecciones frecuentes or a menudo? Frecuente means frequent. A menudo means often. Okay. So tiene infecciones frecuentes en la vejiga, your bladder. En los riñones, kidneys. La vagina, vagina. Las encías, your gums. Los pies, your feet. La piel, your skin. Las lesiones tardan mucho en sanarse. So do these injuries or wounds, tardar is the verb to like take a lot of time. So las lesiones tardan mucho en sanarse. Do these take a lot of time to heal themselves? Okay. Otros síntomas. ¿Tiene más hambre recientemente? So do you recently, are you recently more hungry? ¿Le cuesta concentrarse y o completar tareas? So le cuesta, what is that? This is a really great verb. It means is something difficult for you. So le cuesta concentrarse. Is it difficult to concentrate and or completar tareas, complete or finish tasks? ¿Ha notado algún cambio de visión recientemente? Have you noticed any changes of vision? Any vision changes recently? ¿Tiene visión borrosa? Do you have blurry vision? Las cosas se ven nubladas. So do things look cloudy? ¿Siente náusea o vómito después de comer? So do you feel nausea or vomita después de comer? Do you feel nausea or do you vomit después de comer? Okay. All right, so otros síntomas aquí. Let's talk about la dieta briefly. Just a handful of questions, open-ended questions about la dieta. Okay, ¿cómo es su dieta? What's your diet like? ¿Qué es lo que come en un día típico? What is it that you eat in a typical day? Para el desayuno, for breakfast. Para el almuerzo, for lunch. Para la cena, for dinner. ¿Con qué frecuencia come en un restaurante versus en la casa? So how often do you eat in restaurants versus at home? ¿Qué bebidas toma durante el día? So what drinks do you have during the day? Jugos, juices, refrescos, sodas, otras bebidas azucaradas, other sugary drinks, agua? Okay. All right, so what do you drink throughout the day? ¿Cuál es su dulce favorito? What's your favorite sweet? ¿Y su comida chatarra favorita? And what's your favorite junk food? All right, just to open up the question, get them talking about the stuff they shouldn't be eating. None of us should be eating. All right. ¿Con qué frecuencia come? How often do you eat? Fill in the blank with whatever you want to talk about. Okay, great. Let's take a look at dos casos para conversar. Two cases that you could talk through with your conversation partner. Okay, caso número uno. Julio tiene 34 años y recientemente tiene más hambre. So he's 34 and recently he's been more hungry. a la vez nota que ha perdido un poquito de peso. At the same time, you've noticed that he's lost a little bit of weight en el último mes, in the last month. Okay, that's a good starting point. Where do you go from there? You and your partner can take it in any direction you want to. Okay, caso número 2, Jimena. Jimena tiene 40 años y ha tenido 2 infecciones por cándida en 4 meses. So she's had 2 yeast infections in the last 4 months. Ella también nota que tiene que orinar con más frecuencia y a veces se despierta en la noche para orinar. So she has also noticed that she's got to urinate more frequently, and sometimes she gets up at night to go to the bathroom to urinate. Okay, so dos casos, you could take Jimena in a couple of different directions too, and so these are great oportunidades para continuar a tener conversación con tu compañero. Preguntas. If you have questions, post them in the comment section below. We would love to respond to them, help you add additional questions or topics of conversation around diabetes with your patients. And if you need a conversation partner, head over to the Learning Medical Spanish Facebook group. Put yourself out there and say, hey, I'm this profession, I've been studying Spanish I'm a beginner, intermediate, whatever. I'm looking for a conversation partner to work through the video Viernes lessons. Who's available? Muchas gracias. Gracias por aprender español conmigo. Juntos mejoramos comunidades. And if you have learned something today, please like this video, subscribe to our channel. That helps us keep doing it together. Para más español, head over to commongroundinternational.com, the website, and there's all sorts of medical Spanish resources there for you. And si tú quieres tomar un examen de español médico, if you want to take a medical Spanish test, head over to certifiedspanish.com, create your free account, and you can take an unlimited number of free medical Spanish terminology tests. All right, amigos, nos vemos la próxima vez. Que tengas muy buen fin de semana. Chao.